this, we can go to our next talk. Dr. Vishali ma'am is here. She'll be speaking on multicolor imaging.
Thank you very much, Anirudh, for giving me this opportunity. The topic which was allotted to me was multicolor imaging and why is it important to us. Okay. We all understand that now with most of our instruments like that we are having spectralis and everything. Okay, that's fine. Most of our new imaging cameras, they don't have true color. So they have multicolor and we have publications in retina, ERMs, AMD, so on, which indicate that multicolor is better than true color. Now, does it apply to uveitis as well? Because our requirements are very different. So when there is a posterior segment inflammation, many times you would see, uh, even in the meetings when we show you choroiditis, pigeoness-like choroiditis and all, this is the backbone of posterior uveitis because we are taught that if you see yellow, it's active, if you see dark, it's inactive, and if you see a membrane, you will see certain colors. However, there are no studies available whether we can apply multicolor CSLO confidently uh, in these kind of a situations where we have active inflammation or even the healed inflammation in the posterior segment. So the purpose of this study was to compare multicolor scanning laser with the standard digital color photograph in posterior uveitis. It was done as a thesis of Kajri, who's here, and Anirudh and Kanika, and a lot of people were involved in it. So what we did, we had 69 eyes of the patients who came to us in different stages of posterior uveitis, both active and inactive. So all underwent imaging on multicolor as well as the standard. The multicolor was spectralis and standard was our old Visupac Zeiss camera, the conventional one. So after acquiring the patient images, a clinician who was blinded to the imaging data kind of evaluated whether it was active, inactive, and they gave their comment. And then there were three of us, me, Anirudh, and his lovely wife Kanika, and Kajri showed us all these blinded images, and we believe we have a lot of experience in uveitis. So we marked it. Is there a active? Yes or no. Is there retinitis? Yes or no. And then we went back to other imaging like OCT, ICG, and confirmed that what we were suspecting on color imaging, was it true or not. So it was very interesting results. So when we looked at the epiretinal membrane and inner retinal stria, they were actually better defined on multicolor imaging compared to the standard color photo because of the different wavelengths that it offers, blue, green and all. So for epiretinal membrane it's good, and maybe that is what has been published for retinal pathologies, one of the things. Multicolor imaging could detect ERM in 5 eyes when it was not present. So it is sometimes overdiagnosing. So if you happen to see ERM just on the photograph on multicolor, it's always good to confirm it on OCT because sometimes it may not be there. And then we come to the depth of the lesion. As you understand, in uveitis, it is very important to know whether it is retinitis or is it choroiditis and what is the depth of the lesion. Now here is where we all got caught. So the results were very poorly defined on MCI, and we found that if you are looking for the disease activity, active choroiditis was very difficult to diagnose on MCI compared to the color fundus imaging. So I will show you the example of the cases. Like we were shown this image, multicolored image. What was it? Like none of us actually said this was a case of retinitis because we were wondering is there a choroiditis here, and then there is this color, and then there is hemorrhage. And when you compare it with the standard color photo, you see these yellowish lesion, because that is how we are taught that active retinitis has to appear yellow. When it doesn't appear yellow, we are not able to relate to it as active retinitis. So looking at this, we missed retinitis. Looking at this, we said, oh, this is retinitis, looks viral, because once you look at it, you know what you mean. Problem was not only in the identification of the depth, but it was also whether the disease is active or not. And very interestingly, we had 46 eyes that had active choroiditis, and on color only in 37 we said there was, and almost 100% on the standard color picture, but on MCI it was 80%. For inactive choroiditis, MCI was very good. The problem was with activity. So let's see this lesion. This is what it is. This is the MCI. We could not pick up this choroidal granuloma, to be very honest with you, with all our experience. So if you see this circle here, we thought it was fine. There was nothing. But if you see the standard color picture, there is a granuloma sitting there, which you can't miss. And these are the individual color channels, infrared, green, and the blue reflectance, none of which actually showed that there could be a granuloma. Similarly, this is the MCI, or the multicolor imaging of serpiginous-like choroiditis. If you see here, it all seems healed. The healed lesion is appearing very good. And these active arrows indicate none of us said this was active. We all thought it was healed. Unless we went to the color picture and we realized, oh, the edge was so active. So I think my time is up, and the vasculitis again was a problem. We could detect only in 50% of the cases. Occlusion, fine, you can see occluded vessel, but the active vasculitis is a problem. And then there were confusion like here. We thought it could be a hemorrhage, which it was not, but that is probably we were not used to of it. Like this is a pigment sitting here, and when we color, we thought maybe there was a hemorrhage or a membrane. Now we are getting smarter because we are getting used to of the revised color scheme, but in the beginning, this area of pigment here appears red on multicolor imaging. So to conclude, these days we are relying a lot on color pictures, and many a time even in WhatsApp group you see somebody posting a color picture. What is the diagnosis? So if you are posting a color picture of only MCI and not the true color picture, your experts may give you a very different advice, and that could be a source of problems. So don't rely on this image alone. Rely on your clinical judgment. Thank you very much.
Thank you, ma'am. I think that was a very important point, and I remember we had a patient of toxoplasmosis retinitis, and the multicolor photograph was circulated in our groups in Abu Dhabi, and nobody could actually pick up the retinitis looking at the WhatsApp image. So any questions?
In there of teleconsults and all, I think it's very important too. Because all of us follow retina like mad, and if retina people are saying it's very good, but for us it doesn't work. And
good presentation, Doctor. One on subretinal, you showed where looked like a false positive subretinal hemorrhage when the but what about the reverse, when there is actually subretinal hemorrhage, faint hemorrhage on CST?
We could not detect that also.
Yeah, because everything looks red, color.
We had, because we were shown just images and nothing else. And on images, our diagnoses were very, very different. And the moment you see the true one, you say, oh, this is what it is. So maybe Anirudh is going to work on it to create a kind of uveitis consensus on color photo images, MCI, and to define what should be the definition of retinitis. Maybe we have to change it from the classic yellow appearance to green appearance, or I don't know, Yeah. I think when you are looking at the vitreoretinal interface, the epiretinal membranes, and some of the Mactel is seen very well. Some of the things are seen very well, but for inflammation and depth it did not work. Maybe we relied too much on the color. Maybe in UVR that's the thing. Thank you.